So grateful to
Hey,
have Dr. Rob back in the house. Thank you.
thank you. I'm sorry to have been away so long. Without putting too much of a timestamp on our recording, I live in an area where the fires took place here in California, and so I've been out of my home for 5 weeks, something like that. It's very grateful to be with my family. Very grateful to be at peace, and hope you pray and think about all those people who don't have that opportunity, because there are many people who don't have homes or any place to go. And I have family and friends here. So sorry to have not been here sooner, but hopefully understandable. Hey, Tammy, thank you for making all this happen without me, by the way. Not that you wouldn't, but
It's all good. And we had a really special edition with Angela Spearman, did a two-part on resentment.
mhm.
She did a fantastic job. So it's we've muddled on without you, but we're really glad to have you back. So
Thank
so
you.
Dr. Rob, I put the first question in answered. So let's get started. Betrayed partner in process of divorcing SAPAAA. Can you tell what the differences are between the compulsion of a sex addict versus OCPD, obsessive compulsive personality disorder? Can an SA or PA have both?
Wow,
That's a great question.
I
Yeah.
know. I think that might be beyond. I have to teach a course. So I don't want to say a lot about obsessive compulsive personality disorder, because honestly, it is so unusual, and it's a very rare occurrence. What we see more often is OCD, right? We see people who have uh, obsessive compulsive disorder, which means that it is narrow to certain areas of their life. So people who are compulsive in the way that I'm used to compulsive, well, actually, maybe step back. There's a difference between addiction and compulsion. This is how I look at it. Addiction is things you do over and over and over again, and you feel driven to do them because they are pleasurable, and you're seeking that pleasure over and over and over again for many reasons that some of you know about, related to the people that I work with and that we treat. Compulsion is very different. Actually, it's the same thing. You do something over and over and over again, and you do it to relieve anxiety, but it's not pleasurable. So if I am one of those folks who washes my hands and say, "Oh, they must be dirty," and I wash them again, and then, or I think, "Oh, I must have left the stove on," and I go over and over, and that's more. And I've had clients say, "Oh, I know how many ceiling tiles you have," because they're compulsively engaging in behaviors to calm themselves. But I don't think you and I would have a lot of fun counting ceiling tiles. However, addiction is a same driven, got to go do that. It's going to make me feel better, all that kind of thing, but it's pleasurable. So doing drugs, alcohol, gambling, gaming, sex, these are pleasurable activities. Doing done too much, not so much. um I think, to be honest, I'm thinking about the numbers, and I I would say it's unusual. Maybe, I don't know, 1 in 20 people that I've seen over the years, and hundreds of them, that actually have both. I will say this: I have seen many clients who were diagnosed as being obsessive compulsive because they were compulsively masturbating over and over again, for example, and the doctor didn't know, or whoever it was, about compulsive sexual behavior or sex addiction. So they just assumed, oh, well, it's like counting, the ceiling tiles, just keep doing over and over again. Well, that's true, except they're doing it for a different reason. So I have had people misdiagnosed, but I don't really see a whole lot of people with OCD who are also sex addicts. At least I haven't. But Tammy, you've heard so many lectures by so many professionals. Is there something that I didn't say, or you have a thought about?
No, I agree with you, but it's also getting the right help. If you suspect that is the case, like we have professionals that work with the guys that are in our residential program that understand addiction and those issues. And so, they aren't just going to move them into one category or another
Right.
and miss something. So, it obviously requires sophisticated diagnosis, not Dr. Google, and making sure that we identify those things. And and so I want to switch gears a little bit. You're in the process of divorcing, and like I can only imagine that you're struggling with like what all is going on, etc. And could this have been saved? I don't know, I'm making this up. And at the end of the day, even people with obsessive compulsive disorders or OCD or whatever can get help. Interestingly, on Wednesday, we have Candace Christensen, who talks about neurodivergent, including ADHD and all of those, co-occurring with sex
Autism.
addiction. Yeah, yes, but
Hmm.
on the spectrum for lots of
Right.
different things. And
Hmm.
it's not that you can't get help and change. It is, what do you need to do to make sure that you've got the tools to be successful with recovery? So when someone isn't willing to do the work, and you also identified that there's co-occurring, so there's substances and, sex and porn that we know of, could be eating and other things as well. So you've got someone who obviously would benefit from, well, maybe I shouldn't say it, could really benefit from a higher level of help. And for those that are willing, they can get the help and get a plan and move forward. And then you've got people that, refuse to get help, and move forward. So there is a betrayed partner drop-in group on Thursdays, Moving On Alone. And I encourage you to participate in that if you haven't already. It is free, and that is hosted, and that is specifically for those who have been left, or have one foot out the door.
Well, I think we skipped a question, so I want to, it's
No,
at
no, no,
5:04.
no.
Did we miss
This is
that
in
one?
the answered. I moved this one to answered because it was on before you
Oh,
joined.
I see.
So
Because all I have is
yeah,
obsessive compulsive one in
yeah,
my answer. Okay.
yeah. I'm gonna go to the open ones in just a
Okay.
moment. So
Thanks. Sorry.
you're a little rusty on this. So anyway, just saying.
Well,
So
a rusty
so
period.
yeah. So there's lots of resources to support you as you're going through this. One more thing, Debbie McCrae did a 2-part, webinar on grief, and as part of, moving on alone, divorcing, there is grief. So I would encourage you to check that out, for you as well. So, and you can always email me, Tammy, TAMI at seekingintegrity.com, if you've got some questions. Glad you're back, Dr. Rob. So do you see that one?
Thanks. I
Okay,
did
go to
see that one.
open. Go to
I wanted
open.
to answer the one at
Mm,
5:04 that talked about mood disorders like
yes, that's
bipolar
where
and
we are next.
okay, good.
Okay. So now we're going to stay in open. Okay.
Okay, got it.
Okay, we got a plan. If the addict also has a mood disorder, bipolar, or personality disorder, borderline personality disorder, how will their sex addiction recovery look different? What do they need to do differently? From what I've learned, if they follow the traditional sex addiction recovery model, there isn't enough accountability, and it can be enabling for their behaviors and hinder recovery overall.
Well, I think we have a theme going tonight, a little bit, Tammy. And so let me say this. I believe that addiction is part of the mental health disorder issues. It's repetitive, it's chronic, it's long term, it repeats over stress. You have to watch your life and how you live it. This is true for people with depression. This is true for people with anxiety. Um, but I feel like, again, there's been a little Dr. Google, Dr. ChatGPT here, because mood disorders are completely different things than personality disorders. They're on complete opposite ends of the spectrum in terms of how a therapist would look at this, or a professional. So let me say this. I agree for sure, as someone who is bipolar, by the way, that if I weren't on the medication I'm on and I didn't see the professionals I did and I didn't have the stability I had, absolutely, I'd get depressed and I want to go act out. I'd be anxious, because I wouldn't be stable inside. And so if someone is deeply depressed and it has not been resolved, or tremendously anxious and it hasn't been resolved, they're going to have trouble writing down their name. They're going to have trouble making a sandwich. So they're certainly going to struggle with recovery if they are actively dealing with those issues. But what concerns me is I don't hear my husband or wife went to see a psychiatrist, and that psychiatrist diagnosed them as, or they went to a treatment center, and in the process of treatment, they did an evaluation. So, and the reason I don't mean to be insulting or what at all, but these are such this is like saying I broke an arm or I have appendicitis. Like, there's such different things, bipolar or borderline, that I think that not enough information is here. I will say without question, I can speak for myself, that recovery is hindered by unresolved or undiagnosed mental health issues. For sure. Everything, my ability to work, my ability to join my family, they're all inhibited or limited because of other mental health disorders. Um, and also, I will say that people acting out and addicts, we can look obsessive, we can look compulsive, we can look borderline, we can look, our behavior it can resemble all kinds of things. And I think that's what Tammy was saying, is you really need an educated professional who understands not only mental health, but also addiction. As I said earlier, I had clients come into me for years saying, I've been diagnosed as having obsessive compulsive disorder because I masturbate twice a day. Well, maybe that's not what really is going on. So I don't know, Tammy, I know you can reach Tammy, TAMI, at seekingintegrity.com. We have folks that we refer to all over the country for this kind of evaluation and assessment, and I really encourage you to gather more information before reaching conclusions. And trust me, I get it. Tammy's after me all the time. ChatGPT, well, AI must have the answer. It has ideas, it gives you direction, doesn't have the answer. So I think a professional is really needed here.
And Dr. Rob, can you talk a bit about, because, and this is my experience, so I can't say this is true, but my experience is people with bipolar often get treated for depression because that's
Right.
when they seek out help. And so the symptoms look like one thing, but
Right.
they aren't getting the full spectrum. Can you
Now, why do
talk
you keep
about that a
talking
bit?
about me?
I'm
So,
not, no,
no, no,
but
but you
thank
are
you. No,
because
thank you for sharing on a personal
no, no,
level
no,
too. I
it's
really
fine
appreciate your
because this is
transparency.
my truth, which is I
Okay.
struggle with depression, and I mean the kind where I don't want to go out of bed, get bad in the morning. Um, I would avoid phone calls. I just wanted to be left alone. I wasn't sure I wanted to be around, stuff like that. But when I was functional, so that would be the depressive side. But I also have there are two types of bipolar. I'm going to say the less concerning one, meaning I don't in hospitals and stuff like that. But the culture really supports my drivenness, my intensity, my so when I'm at the depression, anxiety, and when I'm at the moving it, going at the intensity stage of bipolar, I look great. Outside, I'm writing books. I'm writing 3 books at the same time. I'm asking Tammy to do 6 things at once. Everything is going like this, but we're rewarded in the culture for working 16 hours a day. We're rewarded for, and I don't have the kind of bipolar disorder that spills out into, I think I'm a car or something where people lose their minds. So my answer to your question is, or am I back to the actual question? Um, uh, Tammy, because I know I've gotten lost.
It's in the open. It's the 504, but it was
Oh, okay.
the borderline. But I
Right,
asked you
got
an
that.
extending question of like, I just want to
Okay.
know from
Okay.
your perspective. So my point is, like making sure you're going to a specialist that asks all the right questions
Right.
and isn't dismissive of, oh, you're being really productive in this phase, is really key
Right.
to all of this. I often say, even with sex addiction, even with sex, it's like having cancer. You want the cancer specialist. You don't want your nice general practitioner. You want, and that happens a lot. Oh, I'm depressed. Well, your general practitioner will hand you medication, and it may be a band-aid, and you need surgery. So making sure you get the right level of help, is key to this. And the more complex it is, if there are things like this going on, the more you need a specialist. Again, like not Dr. Google or Chat GPT. So,
Well, I
okay.
wanted to add two
Oh,
things to that
please.
real quick. My purpose in saying about my issues is that for 20 years I was diagnosed depressed. I actually was mildly bipolar, but no one saw the other part because I was able to function. It was when I was depressed. It took many, many years to diagnose that it was both. The other thing I want to say really quickly is, yeah, I love therapists. I'm a therapist. I like social workers. I like psychologists. I think people are good without degrees, with degrees, but I would not. After 30 years of doing this, would not say to someone, "You have bipolar disorder." That's what a physician is for. That's what a psychiatrist is for. I might call a psychiatrist and say, I'm sending you someone who I think might be this or that, because that's my experience observing you. But I've had too many therapists who I would not necessarily respect to say, oh, they must be this or you must be that, and then follow treatment that way. And they don't have an idea what they're talking about. I'm not trained to be a doctor. I mean, I'm not trained to be a medical doctor. So I don't have that. I can guess. So be careful, other than Dr. Google, who else might offer you that information? Your neighbor. Oh, my husband's just like that. And he must be, see a psychiatrist and have it evaluated. Okay. Thanks, Tammy.
A qualified, again, so here's another one. ASAM is the American Society of Addiction Medicine. That's a great resource because those are physicians who get addiction as well. So that can be a place to start too. Okay, next one. Hello, and thank you for your help. I am waiting for my divorce to become final. My husband left for a work trip in May of last year, started engaging with prostitutes, and I left by the time he returned home. I have been dealing with his alcoholism for 4 decades. Since this time, he spent $46,000 over the summer on prostitutes and has been diagnosed with bipolar. He got his fourth DUI in August,
Mm.
and it's awaiting court date. Is the treatment for hypersexuality the same with bipolar as it is for sex addiction?
Well, first of all, I'm really, really sorry you're in this set of circumstances, and I can only imagine Well, I can't say that because I hear these stories all the time, and so my heart goes out to you. And I guess the easiest way to answer this question, it was when someone is manic, that's the word I was looking for, when they're in that intensity phase of bipolar disorder, they may act out sexually, they may gamble, they may do all kinds of things. The question is, once they're medicated properly and they're stable, and the bipolar, the driven to spend money, to stay up all night or 3 nights, or all of the manic behaviors, when they become calm, if the person's still acting out, then they're a sex addict. However, someone might get on a medication for bipolar disorder and they calm down and they're no longer doing all that crazy behavior. So I think the point of all this is there are many things that mimic addiction. I know addicts who drink, who spend tons of money, who are having sex with as many people as they can find, but they're not really addicts. I mean, they're not bipolar. The behavior looks manic, but it's really addiction. I've worked with other people who are bipolar, and all that acting out had to do with their mania. So again, this is a very sophisticated, these are good questions. This is a particularly good question. And I have another part of that one time to talk about related to your question, but I I guess, and Tammy mentioned this before, if you're waiting for your divorce to become final, um, and I say this to spouses all the time, I know that you want to understand what happened to you. You just got hit by a truck and you're trying to figure out. It seems like he's on his own path now and you're on yours. And I hope that he's seeing, as Tammy says, qualified professionals in order to resolve his craziness. And maybe if he gets treated for bipolar disorder and the mania really stabilizes, maybe he will show up and be the person you want. I don't know. He's still going to have to be treated for alcoholism regardless. But what I really want, Tammy, could you speak to, if I were this person, I'd be in tremendous grief. I'd be overwhelmed. I'd be frightened. Oh, and let me say this one more time. I hope you get STD tests. Please, please, please go out and get an STD test. Seeing a lot of prostitutes drinking, who knows what, I don't know if you haven't had sex in years, but nonetheless, even if it was 10 years ago, I don't know what this person got into. So please make sure you're safe. But Tammy, would you talk about the self-care issues? Because that's the part I thought you would be really good to speak to.
Absolutely. And that was why I pointed out the grief webinar and the moving on alone. Those are solid resources. One that I have found particularly helpful, we have an empowered women's retreat, and that is in person. That is all about you and healing. It is not about, your addict and what he's doing or not doing. Unfortunately and fortunately, we have no control over another person and they choose their path. We can put up our boundaries, and that's just safety for us. That is not control of them. Clearly, you can tell that he's on a crash course, and I'm really sorry, because there is help, there is qualified help, and it wouldn't have to be that way. And unfortunately, there's often, lots of addicts never get the help that they need. But I really honor you for taking what you need to do, the measures you need to do, for safety for you, for taking care of you. And again, the Empowered Women's Retreat will be in April. It's on our website, under the Betrayed Partner tag. You'll see it. It's the first option, and I think that would be a gift to you to take care of you and shift. The women look different from the day they come in until the night before they leave. Like, they're in their bodies, their faces are softer, they're laughing. Don't hear that the first night. So it really is an opportunity, for you to heal. And really, I'm going to ask you to lean into, healing for you. He's on a crash course, and he's going to have some negative consequences. You have negative consequences as a result of that, but that does not have to define your future as you move forward.
And I just want to add to that is I would love to see you write this question in this way. I'm going through divorce. My husband has been tragically acting out and is destroying my life. I want to get some help. I want to get some support. I want to take care of myself because, when you're in grief, you tend to look at that as being the problem. But now this person's moving away from your life, and now the problem is your own pain. So I do hope, as Tammy said, you take care of that, and we have a lot of resources for that.
So the next one is a pretty common situation. My husband is starting his disclosure. He doesn't remember what he did hardly at all. He pretty much only remembers that he did look at porn a few years ago, but I found out 8 months ago, and how he felt guilty. He doesn't remember arousal or thoughts. How can he do an honest therapeutic disclosure if he has forgotten or compartmentalized what he did?
Well, Tammy, would you mind saying what a therapeutic disclosure is? And then I can maybe speak to the question.
Yeah, so a formal therapeutic disclosure is not a do-it-yourself. I'm going to start with what it isn't. It is not something that the two of you do. I like those are the ones that go really badly. So if he's working with a qualified professional, the qualified professional will help him, identify a timeline. And if you're working with a qualified professional, they will support you. The goal of formal therapeutic disclosure is to set a foundation for moving forward, but it is not all the gory details and, all the whys and everything else, and there's also a process in formal therapeutic disclosure for if something was forgotten, and probably it will be, then this is how it's handled. So, but you absolutely want, two qualified professionals to help you through this process.
Thanks, Tammy. I agree about what it isn't. So I agree with you. I don't think that this is going to go well. And I don't think it's going to go well for a number of reasons. When I worked I run a treatment center and I oversee a treatment center, and we are called Seeking Integrity. And we don't do disclosure because we believe that people need real time to get ready when they're at home to work on this. We certainly set it up for that. But when I was working in outpatient treatment, and I was seeing the addict, I had a very specific set of content that we would go through in order to get them ready for disclosure. And it didn't take 5 months. It took us maybe 60 days. And we would go through every single detail of whatever they'd done sexually since they were, a teen or younger. And we'd go over it again and we'd read through it and we'd clarify it. And so by the time they were ready, and a disclosure is just what it says, by the way, I disclose to you what I have done. The end. You now know you're not in secrecy. Um, so by the time I was done with them, we were very, very clear on what they had done and what they hadn't done. Now, had they done it 5 times or 8 times, or probably wouldn't remember. Had they done it this year or that year, or were they in Ohio or New York, they probably wouldn't remember. But what is important is these are the things I did. This is how often I did it. This is what I spent on it. These are the risks I may have put you at. And do you have questions? It is literally a list that you go over the therapist over and over and over again until you get it very, very specific. By the way, I'm not saying that if I had sex if I was married to you and I had sex on our honeymoon, that you would want to know, but I'm just saying in general, this year, that year, it isn't that important. Um, there is also a process for the spouses where you will sit down and write your questions. I want to know this, I want to know that, I understand. And that too, if the therapist knows what they're doing, gets narrowed down. So it isn't 100 questions. It's maybe, because all the questions, Tammy will tell you this, they really can kind of dilute down to about 8 or 10. But regardless, and then these two people who've been each working with a therapist separately sit in a room together with a professional. It could be these two professionals, it could be another, it could be, but someone who knows what they're doing, and they go through this process together. The therapist who's been working with the addict knows what's happened. If the person isn't being completely forthcoming, we're going to prompt them. Um, so this doesn't sound, the question that you ask worries me because number one, I don't think you have a whole lot of the information here. I remember what I did. I am 63 years old and I haven't acted out in well, many decades, actually. I forget all time, decades. But if you ask me what I did, I remember. I mean, I don't remember what year it was, and I don't remember maybe what they looked like or whatever, but I remember what we did. I remember where we did it. I remember what they looked like. If I had to go through it, and that's what we do as addicts, we go through a timeline. Where were you in this year? Where did you live? Who were you involved with? How old were your kids? We go through a reminder list so that they can remember what happened during that period of time. So, yeah, we forget well, not small to you, we forget details. But things like only remembers that he did porn a few years ago, but you found out 8 months ago and that he felt guilty. Well, poor him. This is a bid for your sympathy. I lied to you. I kept secrets from you, but I feel really bad about it. My answer to be who gives an F? He doesn't remember arousal. He doesn't remember thoughts. You're not going to get an honest therapeutic disclosure. You're not even getting honesty asking questions. So, very simple answer. I don't think that this will go well. I think that there will be a lot of pain ahead because there's a lot you're going to find out after that and after that and after that. Some people, when working with a qualified professional, simply are unwilling to be honest. But I'm reading this and I'm saying, I'm already, Tammy's nodding at me like, nah, they don't know this and they don't remember that. This person's placating you. And as many addicts do, they're trying to get away with the least amount they can so that you don't get too angry or upset about it. I'll tell you just what you know and maybe a little bit more. And then since you don't know more, you'll think, oh, how great, he told me. So this person is, you're setting yourself up for this person to lie to you and have it get worse. Again, I would reach out to Tammy, see what professionals you're working with. If we can help somebody, boy, disclosure is something we do really carefully and well trained in our field, meaning the CSATs and those people who are professionals in sex addiction. Many therapists don't have a clue, they don't understand it. And worst of all, and I think Tammy mentioned it, is when I come home and I say, okay, I'm going to do disclosure. And it's Friday night, and we have the whole weekend ahead of us, and I tell you part of it, and you have no support, no one to talk to, and we have to look at each other the next 3 days. It's horrifying. So this has to be a professional, overseen process by people who know what they're doing. Um, but we don't forget. We compartmentalize. I put my sex life over here, I put my personal life over there, but I know what is in each box. It's not like I just forgot that one. I don't want you to know.
And my perspective, there have been things that, that are legitimate, that are so compartmentalized, and so that I have heard that people went, I
Yeah.
legitimately forgot that. But then there's a plan. There's a plan if you've got a qualified professional. So, and it also depends. We talked earlier about someone who had co-occurring substance use. If there's substances involved, then memory can be really affected. So, but what I hear, just like Dr. Rob, is I don't hear that there's qualified professionals helping you each and both out, with this process. And even the qualified professionals, guess what? I talked to somebody today, in Australia, and she's like, this, I could do a disclosure, but it's just really not my thing. And these professionals that I collaborate with do a great job with it. I was like, perfect, your strengths. And so, there are professionals, that don't do that. So it really does take the right help. You want a good outcome, you want the best help available. This is a mess. Nobody plans on this. Nobody knows what to do.
Right.
We want you to have good help, to navigate this very complex
And if
space.
nothing else, slow down.
Hmm.
Nothing is really going to change that happened 5 years ago, 10 years ago, 15 years ago. This is not a rush into it situation. This is when we're both clear on how we're going to take care of ourselves and we have the right professional. And spouses, I know that you feel, if you know this, you will feel better. If you know that, you will feel better. You will feel, what's the word? You will not feel better. You will feel more upset, more worried, more concerned. And the first thing that's going to come up for every spouse is, well, what else don't I know? And that's what the professional's for, to help guide you and support you. So it is anyway, we've said it, but if you're looking for someone who does this work, drop Tammy a note. And don't we
Yeah,
have some podcasts I did on disclosure? I'm sure there are.
we do. We've got resource and other webinars, and yeah, there's a lot of
So,
resources on that. And but you getting help for your situation, will be, the most helpful, I think. So
and I'm going to plug the podcast because I have people writing all the time. They say, I'd never understood this. Now I understand this, all this kind of stuff. So it is sex, love, and addiction. Sex, love, and addiction. And honest, I'm not selling anything. We don't sell anything. It's free. But I've had partners say, "Oh my God, I finally understand what this is about." I've had addicts say, "I never realized, until I listened to this, that it was this, this, and this. I thought I was crazy." So I think, and there are a number of ones that I've done with professionals who do disclosure on a regular basis, and I think you can learn more. But don't go on ChatGPT or Google for that. You have to talk to us. So yeah, what
next
do we got?
question. Acted out for 10 years. This is from the addict. With sex workers. D-Day was 7 months ago. Immediately started to get help with a CSAT, blockers on phone, started SA and got a sponsor working steps. Since my wife found out, I have had no urges to act out. Would this still be considered a sex addiction or chronic cheating?
You want to start with that, and then
Do
I
you
can
see
think I
it?
can mention that. Yeah. I'm sorry. I'm dealing with, I don't want my pods to run out. So I'm trying to think how I want to say this. We have a honeymoon period. Many of us do when we get caught. So I've worked with people who said, oh, I've worked with people who they get it. I'll give you an example from alcohol. They get a DUI. All right, they're regular drinkers, they're driving while drunk, and they get a DUI. And they say, I'm never, 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 never going to do that again. I know better. And I'm going to, and all of a sudden they don't feel like drinking as much and they're very careful about what they're doing. And they think, oh, okay, that was a big warning sign. I don't want that to happen again. But over time, they don't have a practice toward maintaining this sobriety. And the pain of a crisis fades away. You know this. We've all had a loss, and in the beginning, it's immediately painful every second. And over time, it fades a little bit into memory and felt memory. It's the same thing with a crisis. So if your partner got in real trouble around their acting out, and all of a sudden they started talking to people and getting help, and and setting it up, blockers on their phone, they would feel better for a period of time. They would feel like, I've got it figured out. I understand. But that may just be that they're still responding to the beginning part. What I'd be curious about is in a year, in 2 years, how is this person feeling about it? Because I've had other people, by the way, say this quickly, who said, oh, I fell in love and I don't feel like acting out anymore. And maybe it was I just needed to meet the right person. Well, I got to tell you, falling in love is a great distraction, emotionally, and everything feels filled and fulfilled, and I don't need anything else. But give it 6 months and then they may love you and return to the behavior, because having a crisis or having an incredibly positive experience isn't going to drive long-term change. Long-term change takes long-term commitment to change. And that doesn't happen because this happened or that happened. That happens because someone took on a commitment on a regular basis to change. That's that
Yeah,
one.
I'm completely with you. I was like, oh yeah, honeymoon period. And I'm
Yeah.
like, okay,
Pink cloud.
yeah, 10 years versus uh I
7 months.
yeah, yeah, thank you. 7 months ago. Yeah. 10 years, 7 months, like if you really didn't have a problem, why did you ever start in the first place, I guess? And why didn't you stop, after the first time you did it, went, oh, oops, and I was thinking, um, failure to plan is planning to fail. And I've in recovery. I know I've been for decades, and I know lots of people who come in and they're like, yeah, I don't even feel like acting out anymore. And well, first of all, half the time they're doing something else. They're out in the parking lot smoking cigarettes, in between meetings, or they're gaming or porn or whatever else. They're doing something else. And so if there was a shift in the behavior to another compulsive behavior, you're not really happy, joyous, and free from that's a recovery, saying. So I would encourage you to give it more time. There is zero downside to doing recovery work. Um, our friend Kristen Snowden and our colleague Scott Brassert co-authored Life Anonymous. That is, Scott's an addict in recovery. Kristen isn't an addict, and she was just like, I need help with control and whatever, And so she wrote this book, and it's really good. It's about the 12 steps for non-addicts. Try it. There is zero downside to having a plan to prevent the acting out again, or to identify if there are other behaviors that could be deemed compulsive. So, but yeah, I don't, I think it's, in my opinion, when somebody says they're chronic cheaters, I think addiction, and addiction is, to me, it was a
No, no,
gift.
no. But the
No,
gift is the feedback is in. First of all, I'm sorry, Tammy. I think you need more education.
mm-hmm,
We teach a course called Sex Addiction 101. We teach
mm-hmm,
one. I would suggest that you drop in.
mm-hmm,
You
mm-hmm,
can educate yourself. Tammy said, I think something really important, which I say to every client that I work with, because they come into the treatment, they say, I want to be a better person. I don't want to do this anymore, and I feel bad about it. And then I say to them, well, didn't you feel bad about it 5 years ago? And of course, the real reason they're there is, well, my wife found out, my husband found. All of a sudden, it's so important that they get well because they don't want to get in trouble and they don't want to have losses. So if you were so concerned about this, why didn't you do something about it a long time ago? So there's so many questions here. I think that you need to do more work. Do you see anything about start at essay? How often are you going? One meeting a week or five? So
mm-hmm.
anyway, the more you do, the more you learn. Um, and I wonder how your partner's doing, by the way. I have feelings about that too. What is D-Day? Did they just find out, or is it a professional thing? So many questions here, but you have a lot to learn. Even asking that question says, I think there's a lot more that you can learn. I also wrote a book called Out of the Doghouse, a cheating man's guide to healing relationships with women, or
A relationship saving guide for men who've been caught cheating.
I will hate that subtitle forever. Read it. Take a course on Out of the Doghouse. It talks about
Well,
the
yeah,
difference between cheating and sex addiction. So anyway, you just have a lot more to learn, is what
and
I.
I put the link to the work groups, and there's for both sides of the equation on that. And I should have noted, yes, I'm glad you're doing 12-step work. And if it's if you did 90 meetings in 90 days, if you're really working the steps, steps 4 through 9 are the housekeeping steps. You'll make great progress. You will really have a pretty clear idea of where you are, on the spectrum, so to speak, of addiction. But stopping the problematic behavior is just abstinence. It doesn't
Right,
change your life. It's
right.
doing work that is esteemable, so that we don't have a secret life. We're not lying to ourselves and everybody else, which is what recovery, and 12 step is a great option for that. It is part of. So
I would also do a little bit of history. When you say 10 years, how many sex workers? How often? How much money did you spend? It's amazing how quickly I figured out what a sex addict when I started looking at the numbers. And I thought, oh my God, this frequently, this much, this just plain putting down a piece of paper, how much and for how many years will tell you in 10 years. That's not a chronic cheater. That's a whole lot more than that. Let's keep going.
okay, betrayed partner here. My addict partner has a habit of giving long roundabout answers or non-answers. For example, I asked, "What do you know about her?" His response was, "I only know what I learned about her yesterday." I told him that is a non answer. Either you are fooling yourself into thinking you're being honest right now, or you are intentionally manipulating the answer. Either way, there's a lie of omission. He said he partially disagrees with my analysis of a non answer. How does an addict who is prone to lying and leaving out details come to recognize his own lies and methods of lying? He has been sober and began recovery since 8 months ago, and he attends groups, works 12 step, and sees the CSAT. So he's, first of all, he's really early in this process. I mean, great, chip for 8 months, woo. And, recovery takes 2 to 5 years. And so this is a process. If he's really working the steps, I just mentioned it, 4 through 9, you'll get some honesty, but it's a process. So, but Dr. Rob, I mean,
Well,
I'm laughing at it on some level, because it's like, well, I partially disagree with you. Oh,
well, this is a
goodness.
person who is lying about
Yeah.
lying.
Yeah.
And then they're trying to split hairs. So this is kind of, well, let me throw you a little bit because it really wasn't this, it really was that. There's still a lot of game playing going on here. And I don't care how many meetings you go to or how sober you are, or he's actively lying to you in your house and then gaslighting you. Well, it wasn't really a lie, it was really this. I want you to trust your gut because you're writing here. My partner has a habit of giving long roundabout answers. Well, I have a treatment center and I can tell you how many men come in and they're blah 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 blah, and I have to say, you know what, could you just give me a one sentence answer, because they're so used to using words as a distraction and a manipulation, and you're probably used to that at a whole bunch of levels. I think this man is lying, lying, lying. Does he know he's lying? He may be so used to lying that he sees it as this. I don't care what he sees it at. What I care about is you are being, he's trying to pull the wool over your eyes. And again, I don't care how many meetings he goes to. I don't care how much therapy he's had. He's not acting like someone who is in recovery. Recovery is how you recovery isn't just about stopping the behavior. Recovery is what kind of person is about integrity. It's why I named our program Seeking Integrity. It's about a constant search within yourself to do the right thing. You may not know what it is, but you can check it out. Why isn't this person, your spouse, writing and saying, I have this disagreement with my wife or my partner, and these are the things I've said, and where are this person's questions? Because you shouldn't even be having to ask them. They should. Tammy, you're going to say something. I'm sorry.
No, I agree. And it's also, uh, Debbie McRae is the queen of boundaries. And I love her for part talking boundaries. She puts up her hand. And it can be. Yeah, I understand this. The story you're telling yourself. Blah blah blah. She can. So her boundary course starts in April. It's an online work group. I already put the link for the online work groups. They're on our Seeking Integrity site. Super helpful for you. He's still in the, I'm gonna spin things and do all of that. You don't have to buy into it, and for you to go, no, I'm gonna just choose me. And so, I'm not even gonna put, like, if it's dysregulating to you to try to dig into this and make him, see the light, then what do you need to do?
Right.
Yeah, yeah, because like at some point you go, like, yeah, I'm done. I'm gonna go take care of me. I know that's the story you're telling yourself, and I'm gonna go take care of me. And it's you stepping away and taking care of you is a shift.
Well, I also want to say that how does an addict who's prone to lying, we're not prone to lying. We lie all the time about everything. Listen, if I'm having sexual lives with other people, that's not being prone to lying. That is keeping secrets, manipulating. So I am concerned about that you've been hearing these kind of stories for so long. Well, I'm really working and I'm really committed, or I never did that. That you're kind of don't trust your own gut, that you know this is lying, you know you're uncomfortable, you would be asking this question. And so it goes back to how are you? I would assume he's lying, whether he is or not. I would just assume he's lied to you all these years. I would assume it. If he is lying, how are you going to take care of yourself? What are you going to do? How do you take care of you? You may never get the truth out of him, but what are you going to do if you assume? And by the way, every addict who walks into my office, I just assume they're not telling me the truth. I say to them, you know what, when you're ready. Um, in fact, I've had therapists say, I can't believe I've been seeing this client for a year and they're still lying to me. And I'm like, well, of that whole, if your lips are moving, if you're an addict and your lips are moving, you're lying. It really is true. I will say this though, there's one more piece of it. Sometimes we convince ourselves that we lie because we don't want to hurt you more. Well, if I told them this, and they'd be overwhelmed. And that too is a lie, because what every spouse I've ever worked with wants is the truth. You just want to know what has happened and what has been going on. So for me to say to myself, well, as long as I don't want to upset them, so I won't tell them everything, that is to completely misunderstand what is upsetting you. It's not necessarily the thing that happened. It's the lying, the manipulating, the gaslighting. It's a lack of trust that is a real violation. So, yeah, I worry about your falling into the trap, even using your words of dismissing how upsetting this is or making it right for him. This guy's a lot of work to do. I assume it's a guy, by the way. I don't know.
Yeah.
Oh, and I
So on
just
these we
learned
use
yesterday.
go ahead.
I'm sorry. Uh, I'm sorry. I asked, what do you know about her? And his response was, well, I only know what I learned yesterday.
Yeah, I
Really?
know. I know
I bought
that
that
was
car. I didn't learn anything about it. I just thought, oh, I'll buy that car. It's just not like that. So you're being lied about it, being lied about it, being lied about. And I really hope you find support from other spouses through the website, Seeking Integrity. There's all these free
boundaries work
groups.
group. Yeah.
Just listen to what these other men and women have to say, separate gender, but you'll
Mhm.
find your place in you're moving through a process too. And it's painful. Who wants to believe that someone who is promised that they're really being honest isn't? You just, yeah. Anyway, let's keep going. I know we have lots of
Okay.
questions.
Do you folks think it's a good idea that, say, like a group of trade partners who have become acquainted and close in their support group, if all of their communication between each other is via text messaging with each other and not even a call sometimes? This is from the addict partner. I recognize that. So I've got some thoughts on this. First of all, the vulnerability for them would be if the addict partner decides to go peeking at someone's text messages and violate their privacy. But oh my gosh, for partners to have, like, I can't tell you, I can. I have subbed in an inordinate amount of betray partner drop-in groups lately because it's all good. But like, for the partners there to come into that space and be able to share because they feel so isolated, and so whatever form of communication. I mean, the nice thing about text is you can do it on the fly. It doesn't require setting aside time that's mutually convenient and everything else. So whatever form of communication is working for someone,
Right.
fantastic. But I hope that privacy is respected, from for the partner. So thoughts?
Well, I'm smiling because I'm thinking of the parent who says, my kid, since they went to college, they never call, they never reach out, they never pick up the phone. And then I said, but have they been texting you? Oh, yeah, they text 3 times a day. Our expectation of the way people communicate to be close has changed. I'm thrilled that the two of you are connecting with each other and that there's a reaching out. And I think that's
No, this
fantastic.
is the addict partner concerned that his betrayed partner is
Do you think
only
of this for
texting. Yeah.
do we think a good idea is that a like group of betrayed partners have been acquainted, close, if there's communication with each other via text? Yeah, I think you partners should be texting each other all the time. I think that's great. And if you don't call, you meet live here.
Yep.
It's all good.
And
More
many
is
of them are
more.
on the drop-in groups. So okay, next question. Thank you for discussing the difference in relationship between addiction and co-occurring mental health issues. Personally, I struggle with major depressive disorder and generalized anxiety disorder, and years of therapy and psychiatry only provided symptomatic relief. Fast forward to recovery. I'm almost 3 years into solid recovery with all the inpatient group, individual therapy, 12-step, etc. And guess what? No more MDD and GAD, but we had to tackle my addiction first to see that. Oh, thank you. Thank you for sharing that, and woohoo.
It's a great comment because if you're reasonably functional, take on the addiction. Because when I was active in my addiction, I was depressed all the time. I felt ashamed all the time. Some of the symptoms of depression that I show with the bipolar disorder were exactly the same. I used to think, well, do I act out because I feel bad about myself, or do I feel bad about myself and so then I act out? The answer is it doesn't matter. Stop the behavior, get help for the behavior. One of the things that I think people come to our residential program is when they've done everything, they really are committed to change. They're really doing everything they can, and they're just still stumbling over it all. That's a reason for come to residential so that we can see what is going on with you in a more personal, more direct, and a 24/7 way. But yeah, I think there are lots of people who are misdiagnosed by professionals because they don't have a clue what's really going on with the addiction, and and so many don't. So, but thank you, as Tammy said, for saying that, because yeah, stop the behavior and a bunch of things. I can concentrate. I feel better about myself. All of the things may change. Now, I'm not saying someone who's suicidal should just get into recovery and not, obviously if you're not functional, but if there are more feelings and anxiety and yeah, get into recovery and see how that goes. You'll learn more that way.
Well, and recovery is about having skills to do life that we lacked. And so we found maladaptive coping mechanisms. And, so I'm not surprised. I mean, I often hear people like, I'm anxious, I'm depressed. And I'm like, yeah, I think every addict probably is on some level. It just doesn't raise to a clinical level. And again, qualified professionals can help you, identify that. Okay, so the next question, are all CSATs trained in therapeutic disclosure? Can any CSAT help with this, or is it a special skill set? So
I'm
yes,
leaving that
all
one to you,
CSATs,
Tammy.
I know, I got this one. All CSATs are theoretically trained in this. Can all CSATs help with this? No, there are some that I will never refer to. I've heard the horror cases about what they have done to mishandle that. And it is a special skill set. And like I mentioned, I was talking to a therapist and she's like, not my cup of tea. I'm going to do this and I'm going to refer. Great if they're collaborating with people who
Mhm.
are actually good at this. Um, Dr. Rob and our clinical director, Aaron Snow, co-host a peer case consultation group on Tuesdays for therapists who are theoretically all trained in this. Guess what the number one topic is? I mean, like there's other topics, but this formal therapeutic disclosure comes up often, and particularly if you have two therapists and one is rigid on this is the only way, and there's no plan with the client's best interest at heart. So there are people I absolutely would never refer to. Could be an okay therapist, and maybe even a decent CSAT, but if disclosure is part of the process, there are some people that do it, with esteem and kindness and,
Grace.
yeah, and
Mhm.
great. That's what you want. This is tough enough. You don't want it to be a botched up job.
I would want to know more, by the way. I would, if you don't know whether they're trained or not, ask them what is their process. Does the other person therapy, are you in therapy? What happens after? What happens before? And then come back and say, these are things I've learned, or go one of the other support groups and ask them information. I want to go a step further than Tammy. I'm going to use another metaphor. Let's say I'm a general practitioner as a doctor, and I want to learn more about how to treat patients who have cancer. And what is that about? That doesn't mean I'm a cancer specialist. It may simply mean that I've learned a whole bunch of stuff that I can add to my information. So many therapists are wonderful therapists, but they have no idea how to treat addiction. And so they come up against the CTAT training and they try to kind of fit the training into what they're used to doing rather than understanding that it's a whole other way of working. And so I think you have to be, again, write Tammy a note. There are books about there, I'm pretty sure, about what is a healthy disclosure and what isn't. So again, educate yourself. Yeah, write Tammy a note. She will absolutely give you some direction and support. This
Yes.
she knows really well.
Yes,
And it could
and
destroy you if it, I mean, it
exactly,
could come
yes.
badly.
A good therapeutic disclosure, it really does set the stage for moving forward, and healing. And a bad one is like it just shreds any, hope for moving
For
forward. So, and
change. Hmm.
it's a lot of extra pain that is not necessary. So, okay,
Hmm.
joining the group for the first time here. Welcome. My best friend is a sex addict, but also has higher functioning autism, severe inattention, ADHD, and a lifelong history of isolating, probably because of the autism first, but then because of sex shame. I'm one of his primary supports in this very small social circle. I'm not a sponsor, and he doesn't have one. His insurance company doesn't have a single treatment center in the state to get help. The one addiction counselor he works with told him his central addiction of lying is no big deal. He really struggles with authentic person-person communication, but trust me, is there anything I could do to be more supportive of him in a way that is better suited for these other than very prominent features in his life and sex addiction? I put a link in the chat. I'm going to put it again, but we have an expert on these issues participating on Wednesday about co-occurring autism and sex addiction, free. This is free. And it will be recorded. So even if you can't join live, highly encourage, you know, your friend, you, whoever, it'll be on YouTube. So that would be my biggest
Oh, right. I heard about
thing.
that.
But yeah, but please talk, Dr. Rob.
Well, one of the things I am most proud of our treatment team and Aaron is that we do a lot of educating. And we saw that a lot of our sex addict clients struggled with ADD, ADHD, being on the spectrum. And I think one of the challenges of being an addiction therapist is you can miss mental health things or you don't know how to manage them. So one of the things I'm really proud of is we have had a lot of training in spectrum disorders and autism. We have a lot of training in ADHD. So I know if I'm seeing you, I know what professional to call in, and we'll have people in treatment and we'll say to them, you know what, we want you to have some sessions with this person who's an expert in autism, who's expert on the scale. Um, when you say insurance company to have a single treatment center in the state to get help, that's not unusual. Um, Insurance companies are quick to pick the. I'm not be dismissive. I think insurance companies are going to make an arrangement, whether financial, whatever facility they want to. It may not be the facility that's best. And to be honest with you, we don't take insurance, and it's not because the only reason is I don't respect the way they work. As a therapist in treatment centers, the insurance company would say, oh, they can stay as long as they want, as long as they need help. And then 3 days later, they'd say, do they still need to be there? Or they'd say, you're only going to spend this much. And at the end, so anyway, I think insurance is a dirty business and it causes a lot more pain to people than it does help. But more expert, I don't think you can help here except to be a trusting, nurturing friend and to encourage your friend to get the kind of help that will help direct them. And by the way, people on the spectrum can get a lot of help, very direct help about how to interact, how to do things, how other people. You might learn how to best help your friend by learning how to. When he says this, does he really mean that? When he walks out of the room, what's really going on with him? Did he feel uncomfortable? You don't necessarily know what those cues are. So you're learning more about it. But this is really hospital may or may not be useful. But again, I keep saying this, Tammy, but right, Tammy, these are areas, when you talk bipolar and mental health, and and disclosure, this is where we really know a lot of people. What I appreciate though is that you love this person and that you care for this person and you want the best for them. I can't think I would want you as my friend for sure, because I know people with autism and ADHD and OCD, sometimes we say the wrong thing, we do the wrong thing, we can insult people and make them feel bad. And you have stayed in there to support this person, despite, I'm sure, the challenges of being in that friendship. So good for you. We got,
And I thought of
uh,
another, I know, I thought of
go
another
ahead. I
resource.
watched your brain
Um,
working.
yeah, it's true. So on February 7th of last year, and I already put the link for previously recorded webinars, my colleague Scott and I did one on 12 step, and we talked about navigating that because it's confusing. That might be useful for you and your friend to start with because he doesn't have a sponsor. it's overwhelming, to navigate that space. So there could be pieces of that that you as a friend, not a sponsor, could help support, just navigating that. So just an idea. And I did put my email address because we've said it about 1,000 times, in the chat too. Okay, so Dr. Rob, the next one,
And by the way, having obsessive compulsive disorder, having being on the spectrum doesn't mean you have to lie.
mhm.
Lying is a personality issue. Lying is about the person who you are, not necessarily your interactions with the world. So I wouldn't see that addiction counselor again.
I agree. Oh yeah. Oh, I forgot about that. It's no big deal. Yeah, like no, lying is a big deal because
Yeah.
denial is I'm lying to myself. That's where it all starts, and then lying to everyone else. And if people don't want to be around people that lie, so it's isolating as well. So, okay, I'm the betrayed. Discovery was almost a year ago. I have an APSATs and additional therapeutic support, and my partner is in a program, and he has a CSAT. We have not started the process of disclosure yet because our therapists are waiting to see if he can get more regulated and not rage before entering disclosure process. My partner is showing up to many groups and reading books. He's trying, and he has a long way to go. I know for a fact he still has accounts associated with sex and dating. I do not know if he's currently using them, but they are active logins. These accounts include a dating website, an app to use others' remote sex toys, and a website to buy and sell women's used clothing. These are the ones I know about. I was going to keep this knowledge to myself for the disclosure process to see if he's honest about them. But with no disclosure in sight, these are open accounts make me uncomfortable. What should I do?
Well, I don't think that you just because you go to some groups and you're reading books and you're the key word to me here is trying. you know, trying. And someone who is really committed to change is not still doing these things and lying about them. And I don't hear recovery in here, to be honest with you. I can see, I go to 100 meetings and see, we say all the time, go to 12-step meetings, get support. But the essence of that, that I can't, none of us can help with is their motivation. You know, if I am motivated to keep you quiet and to lie and look good while I'm still doing all this stuff, well, then I'm not in recovery. If my motivation is to become a better person who's more honest and real and has integrity, absolutely, I will get further. So I do not. I would feel very uncomfortable. These accounts and currently using them, but they're active. Of course, is using them. They include a dating website, remote sex toys. This is all still going on. And so my concern is for you and how devastating it will be for you because you're trying so hard to believe in someone that you care about and they're not really giving you a whole lot of tread. I would never do disclosure because you're not even giving honesty in the day to day. So why in the world would you think, why would you think you'd sat down and all of a sudden you're going to hear all this stuff? The point of disclosure, by the way, is not to prove that I've been lying or I've been telling the truth. That is so far before disclosure. We should be in a place where you know where I'm at in my recovery and you see the work I'm doing today and you feel safe enough to know what I see them doing today and what I'm hearing and feeling makes me feel like disclosure is going to be honest. I don't have a lot of hope for the circumstances you're speaking to. And I know, Tam, I want to answer the next question, but um, there's one more thing. It's not, I feel like that you're making excuses. He has a long way to go. Doesn't have to be a long way to go to stop. Look, I may have a long way to go in my alcoholism recovery if I were an alcoholic, but I don't have a long way to go in terms of stopping drinking. I just stopped drinking. And so long way to go means how are they getting along with the changes and how much support do they get? But long way to go doesn't mean, well, I'm just going to keep acting out in this way and that way until I feel like I'm ready. So I'm concerned for you because this is not the person that you want them to be.
And I want to do the next question too. I want to just tag on this. I have concern about the CSATs because if they're going, well, we're waiting, to me, I'm wondering why
Right.
your CSAT is not coming to you and going, this person is not in any kind of recovery, like the raging thing, so not okay, and you having healthy boundaries about that. If you rage, I'm going to do. But this person, you don't do a formal therapeutic disclosure if somebody's still in active addiction and this person is acting
Yeah.
out. And if they wanted to set the stage for that, they would have their therapist would have talked to them. All of these groups, they all would have be talking about what do we need to do to clean up our technology and make sure it's safe. So I'm with Dr. Rob. This person is not, and I appreciate you holding out hope that this person's eventually going to get a clue, and he might. but you're a really, he's a really long ways away from that. So, and for now,
Yeah.
take care of you.
Yeah, and the rage part really upsets me. By the way, I don't know
Yes.
if you know this, but some of us will talk to a therapist who says things to us, and then we'll go home and lie to you. Well,
Yeah,
my
but it
therapist
says
said this.
it says our therapist,
Yeah,
and
no,
so yeah,
n- I'm
I checked that
concerned.
too.
There's a whole lot of fixing and making, of course I wouldn't do disclosure if someone's raging, but I certainly want to deal with the raging. So in any case, I think we should answer the
Okay.
next one.
Yeah. So the next one, I've been attending seeking integrity groups for betrayed partners for a few months now. I hear presenters talking about the wonderful inpatient treatment program. Frankly, I can't see my husband not acting out with other participant first chance he gets. I found out he has acted out with anybody, and uh, he could get to for years. Is the program designed to keep addicts separated so they can't act out together?
Well, I would say it's the opposite. The program's designed to have these people get so close to each other and to learn how to be honest and committed in relationships that are non-sexual, that they're constantly talking. They're talking all day long. They're talking with us. They're talking in the evening. Believe me, if I was in the treatment, we have to take 8 people. We have, I don't know, half a dozen to a dozen. Well, we have all these people. Well, let me say this: our clients are observed 24/7. There's always someone with them 24/7. We don't send them to a hotel. They are monitored. They're there. We're pretty aware of this stuff. If I get a hint, if any of us get a hint that something's not right, we're going to talk about it. And besides, this is a whole group of people. This isn't just 2 people. So if my roommate is starting to whatever, if they're looking at this person a certain way, so all I'm saying is that our job is to raise awareness. I don't necessarily want someone to come to treatment and I'm never going to flirt with anyone in treatment. Maybe they will, but believe me, if they do, we're all going to know about it. We're all going to be on top of it. I think treatment is a great place for someone to struggle, not to act out, but to struggle. Um, I don't think it's about them being separated. I think it's about being consistently monitored, being pushed to have integrity, being pushed to be honest. I may be masturbating in the shower, but I'll tell you what, if I start fooling around with someone else, everybody's going to know. It's a very, very tight group of people. I wanted to say something else about that. La, 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 la. Um, the program is designed to help people come together for honesty and commitment. If someone were acting out in treatment, first off, that actually happened, we'd have to look at whether they could stay or not. We're very serious. My job is to keep everybody safe. And by the way, if I'm kind of getting something with going with you, everybody's going to know because we don't let, so I'll give you some examples. We don't let clients go off into rooms together. They don't get to go in the bathroom together. That we very much monitor. So the answer is, I don't think recovery takes place when you're alone. I think recovery takes place in a healthy family, in a healthy community. In a healthy family, you turn to someone and say, something's bothering me. In the families I grew up in, no one ever talked about whatever bothered us. So we are constantly pushing these people to talk about it, talk about it, talk about it. So if there were something going on, believe me, we would know. We're not easily fooled. And I want to say that I run this stuff. I've done this for 30 years. Trust me, I can just like I can smell pizza when I walk by a pizza parlor, I just know it, and I'm not fooled because I'm not their spouse or their partner. I get it. So I actually think that residential treatment is the best way to do this. I've had people go to workshops and seminars, and there in the evening there were no hotel. They're going and staying at a residence with other people. That's when I worry. When you have a
Oh,
solid
flying in their affair partners. Like I mean, I hear those stories. They flew in their affair partner because they're at a
Well,
hotel at
or
night.
they chat. I mean, all of their computer time is monitored, all their
Hmm.
phone time is monitored, who
Yeah.
they're talking to, when they're talking to. So it is, I think, designed in every way it can be, not to shame, but to say, boy, you're really in trouble one more time. And by the way, I promise you, if I was in treatment, at least in our program, and I looked over and I saw somebody, yelling at their spouse or chatting in some way that I would bring it up because if I want to heal and I see this going on, I start to feel like there's dishonesty, like I'm not safe, like I don't know what to do. Um, the clients hopefully will start coming forward and saying for themselves, I don't feel comfortable in this situation. And by the way, I want to say with all due respect, I've worked at a lot of treatment centers where people act out all over the place. By the way, I don't know if you know, we're gender separate. we don't treat women. I've opened programs for them, but I absolutely believe that if mixed gender were there, people would act out. I don't have many gay men who will want to act out with the straight guys, to be honest with you, for a whole bunch of reasons. Has there ever been acting out in the centers that I was at? Sure. Mostly they were large hospitals and lots of people going in and out and dealing. But we have one house, one treatment center, one group of people who are working with you over and over again.
Awake staff at all times,
There's
so
24. So anyway, I feel does it happen? Sure. Does it happen with us? you know, Look, you can, if you really want to do something, you're really going to find a way to do it. But it takes an awful lot of time and money and effort to go have sex with people. You don't have to come into a treatment program. You can go out and do that on your own. So um, I can never say to anyone 100% will never happen, but I can say of all the places I've worked and created, I think we're the best. And I really don't believe that that is likely to happen without being dealt with very quickly. So, and we do throw
and
people out, by the way.
yes, and I wanted to I know for sure that there is no more expert treatment program that Seeking Integrity provides. We've had guys that have gone to all the other treatment programs, and they have affirmed that as well. Separately, I want to talk to you, partner, because I can only imagine how painful this is to think that there is zero hope for help. That no matter where this your husband would go, he's going to act out. He's never, ever, ever, ever going to get the help that he needs to be a man of integrity. And so part of this is, what do you need to do to take care of you? And what happens if you try? What happens if you went, I'm going to be willing to have just a tiny little seed of hope, and see if this expert treatment team can help this guy who is struggling with compulsive behaviors that are so egregious and so hurtful, that you're here going like, I don't even think I can send him to the expert treatment program without him acting out. But all of the resources I shared before, and my emails in there too, please consider those for you. And I hope and pray he does get help, because recovery, like the person said earlier, 3 years doing good, feels better. It's worth it.
I wanted to add one more thing, Tammy, which is that we are constantly talking about these issues. There's nothing under the cover. There's nothing undercover. There's nothing. We are constantly talking about, when did you do it? Where did you do it? How did you do it? Someone else is talking about it. They're pushed and pushed and pushed to tell the truth about the past, the future. We're pretty good at pushing people. It would be very, very hard, I think, if someone wasn't truly emotionally deeply sick, to be constantly questioned about this every single day over and over again and be lying at the same time. It would be very, very difficult, at least the way we're set up. Um, so Tammy, I'm so glad to do this
Yes,
with you. It's
I'm
been
so
way too
grateful you're
long.
back. Woohoo! Yeah,
Hopefully our home will be put back together and not too long. But as I said,
but you
I'm
guys are
grateful to have a
together.
place to
That's what I care
stay.
about, is you guys are okay. You're all, nothing physically happened to any of you. So, you guys will, together and with support, it will be new and different, and you will be okay. So,
But you know who's doing best in this whole process? Our dog.
of course.
She just, as long as she's with us, she
Yeah.
doesn't care where we
Yeah,
are, what we're doing.
exactly.
So
Yeah.
anyway, good to see you all.
Be
I
your
hope this
dog,
is
right?
helpful.
All
Woof.
right. Talk to you later. Bye.